Okay, let's talk about our patient today.
Our patient today is a dentist.
Young lady, a preeminent lecturer,
A dental hygienist
from Bulgaria,
Buffalo, New York.
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers.
10 Lumineers,
6 Lumineers.
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
And now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Good morning to Sacramento, and good afternoon to Miami and Atlantic City. I'd like to welcome you to an over-the-shoulder placement course we're doing here in Santa Maria today. We do these every Friday, and we have about 15 or 20 dentists here that get to see these cases live. They're going to watch this case and one or two more that we're going to do today or tomorrow. Been doing these for over 20 years, and we don't have any pop-offs or clinically proven, no anesthetic. I don't want to be deprived of the sensory system. Most of you would never grind on sensitive tooth structure if you knew you were doing that. But if the patient's numb, anesthetized, how can you tell? You can't. Now, what are your two most reliable surfaces you can bond to? Enamel. What's the other one? It's porcelain. We bond to porcelain surfaces the same way we bond to enamel surfaces. What's different? The surface preparation. So we have what we call a rule of 55. 5 surfaces, 5 steps. Okay? Surfaces are enamel, porcelain, dentin, old composite, metal. You can bond to all of those. If this thing goes well, and I hope it does, and I think it will, and so far it has, okay, it's because I've got a knowledgeable assistant. Let's show the setup to everybody. At least it's got prepared there. This is what it should look like. Now, your first inclination is you see all this, a piece of this and a piece of that. But these are really groups of things that are put together. But she's already treated those pieces of porcelain with porcelain conditioner, which is citric acid. Very important that you use citric acid. It's an organic acid because that's what activates that surface when we put the Serenade Prime on. The Serenade Prime is a silane. And it's very, very important to activate your silane just before you're ready to bond it. Something that's very important, I'm working without anesthetic. And he's not scared because he knows I've got 4-power magnification. Now, before I became a dentist, I became an optometrist. And the reason you want 4-power is it gives you better vision than you can have at any time, no matter how young you are. Usually, the way you get fitted by most of the companies is they want to give you 2.5 power. That puts you back to where you were when you were 25. So you can look at a magazine with a 4-color picture on it. It looks very nice. Then you put 4 power on. Wow. Now it doesn't look nice. It's a whole bunch of little pixels. I will be visually this far from the surface when I'm working on Dan's teeth. But physically I'll be this far. It just opens up everything for me so I can get in to get that ultrabond out and around those places. So I strongly recommend that you get magnification, 4 power, even if you're 25. What else is going to make this easy? I'm going to do placing about 8, 9 porcelain veneers, maybe 10 on him, and I'm going to do it in less than a minute, polymerizing them, because I have a sapphire light. Next thing is very important is getting an impression that is accurate and not distorted. So I recommend you do 2 things. So after you take your impression, I like to use the Invisalign technique, and that's a double wash, and let your patient read some magazines or watch some the videos on placing Lumineers, and then make sure that you check that margin that you're satisfied with it. The other thing that you got to look out for is taking the impression out too soon. Every so often we get a case where the dentist says, these fit the teeth terribly. They don't go down, they fit the model really well, so what happened? Probably the impression was taken out too soon. Very simple. Leave it in an extra 30 seconds to a minute. Your big challenge after you learn how to do this, because this is a no-brainer, you got to think about it. I'm doing all this talking. We're having a nice visit. Everything is ready to go. This is like flying an airplane. I just got to walk out, firewall it, sit there, plane takes off. And then once I got them bonded, if they don't fall off, so far they haven't, and we're airborne. Then after that, we'll just do the finishing. Okay. So we're going to micro etch 3 porcelain surfaces. Now don't breathe. And you just take the glaze off. And I don't like to grind anything down because one of the things that's nice about this is that Dr. Cook is not pleased with the result. I can remove the porcelain and repolish the surface. Okay. The only thing I don't like about porcelain preparation is I don't like the sandy stuff. And I'm putting some paint on dental dam on the lingual side of his teeth. Same thing you use when you're doing chairside bleaching. And I'm using the blue shade so that when it's time to remove it, you can distinguish that from the ultraviolet. Close your eyes. Best way to protect your eyes from the light is to close them. So I place the light, close your eyes, and then I look away after I placed it, and I give it a 3-second burst. And then that polymerizes it to a rubbery state. Now we'll let everybody take a look. And where you got those diastemas, so you want to be sure it doesn't go running from the palatal side to the labial side. Now we're going to do surface preparation on the porcelain. So I'm going to place a dab of Porcelac hydrofluoric acid on each of these porcelain surfaces. Brush. And it's medium viscosity. But what distinguishes it from what your laboratory technician uses, and be very careful that you only use Porcelac because it's buffered to a pH of 2.9. That's about the same pH as Diet Pepsi. So that's how we put this on. And we want to suck this off first before we wash it, so you get most of it off. Take some more. So suck off as much as you can ahead of time. Then you have less to wash off. So in a way, you're just preparing this porcelain the same way you prepare enamel, but you're using different solutions. And wash that off really good. Now we're going to put some citric acid on the porcelain. Remember why that is? That's an organic acid to activate your silane. And so we just put the citric acid on the porcelain, and we're going to put phosphoric acid on the enamel. Phosphoric acid is inorganic, so you could never use it to activate your silane. Now we're taking etch and seal. It's 35% phosphoric acid with aluminum oxalate in there. The aluminum oxalate is in there so that when you're doing your regular operative procedures, you get some of the phosphoric acid on the dentin and opens the tubules. The aluminum oxalate will seal the tubules. So it helps prevent sensitivity. Okay, now we have the surface prepared for Serenade Prime. And that's the silane that we're going to put on the porcelain. Now we're taking tenure and putting it on the natural teeth, the enamel. Tenure AB. Tenure was developed by Dr. Ray Bowen. We call it Bowen's bonding system. There's been a lot of bonding systems come out since then that your dealer wants to sell you and manufacturers want to sell you. Nothing works better than Bowen's bonding system. It's light independent. You don't need a light to get it to work. And a lot of these systems out there won't work with all the different brands, and they are light dependent. And a light dependent system means if you don't get enough light there, you don't get enough conversion, enough bond strength. With tenure AB, you get conversion to any resin system, and you'll watch us put some tenure S on here in a little bit, but not yet because we're going to try in a shade, left central. Okay, Lisa always calls out the name, and when I was in school, they gave us 3 systems for identifying teeth. And I got so confused, right central, that I promised myself I would never learn the number system, because if you got your system mixed up, you're really in trouble. Now what you're looking at are 2 pieces of porcelain that are exactly the same shade. But the one on the left, his left, is not quite the same shade as the one on the right. And that's because when light travels through a medium, it keeps going forward till it exceeds what they call a critical angle. So when you have air between the veneer and the tooth, you get the bounce back from the etched surface, and that's a different shade than what the veneer is. And we'll try this in. Now remember I told you something about a solution called Tenure S. Tenure S we'll put on after we take this off to remove everything. And let's get the mirror so we give our patients a chance to identify what they think they want. And I usually just let patients look at 2 shades, because if you put Lumineers in, they don't look good because they're too big, they fill the embrasure, super good. Now you get to take a look and tell us if you like the shade on the left better or the shade on the right better. Left. Okay, he's taking the white shade. It will take most of this try-in paste off. And I'm taking it off the teeth, and then I'm going to cover them with something called Tenure S. Tenure S will dissolve the Ultrabond try-in paste, or not dissolve it, but combine with it, remove it. We're putting Tenure S on for 2 reasons. One is, once you've prepared the surface, a race begins between contamination and resin. Now, whatever gets there first wins the race. So we put this Tenure S on, and it also removes some of the try-in paste, because the Ultrabond try-in paste is exactly the same as Ultrabond, except, better get these over here, it doesn't have any activator in it. But don't do the try-in paste after you put Tenure S on the teeth, because it'll polymerize it. How do I know? Well, I was placing about 10 on my secretary who wanted whiter teeth. And so I put the etch on, and then I put on the Tenure, and then I put on the Tenure S, and then we tried them all in. They looked good. Started to take them off. Not one of them came off. Left central, it had caused all of the try-in paste to polymerize. So everybody was panicked, including me. And that's the white we're using? Yes? Okay. Right central. And I like this little device because it just picks it up and carries it so nice and easy. Okay. Very good. This is really the critical stage right here. And you can see, you don't want to spend a lot of time with this not polymerized on there. And the second bicuspid on that porcelain surface. And I just start checking these. Take a brush, make sure they're seated. And the Tenure S is beginning to get some of this to polymerize. I always want to see excess around my margins, because if I have excess, I know I have enough. If I have just the right amount, it looks the same as when I don't have enough. 2 millimeter tip, 1 second. And I'm going to start here in the front. Close your eyes, not too much pressure. 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 Close your eyes. Okay, so now we're airborne now. These are not going to go slipping around. But wheels aren't up yet. And so that's an important feature. Let's get that cotton roll with the tenure S on it and start wiping all this off. Wiping all this off. So now we're going to take the 9 millimeter tip, 5 seconds in each tooth, 10 teeth, 50 seconds. 1 minute, we're going to set and polymerize 10 porcelain veneers. 1 minute. Okay? Close your eyes. It's a good time for questions while we're doing this. Close your eyes. Now let's take a look on the lingual side. I'm going to take what we haven't polymerized and hasn't polymerized, and I go from the palatal gingival toward the incisal, so that if I have any space between the porcelain and the tooth, it gets filled in with Ultrabond. Okay, so let's give them a quick look at that. We're going to remove all of the Ultrabond. See how this comes out? And I'll let you take a look at the lingual side here in just a moment. And just flipping out all that paint on dental dam. And now we are airborne and we're wheels up. So we'll take this out. I'm using a football-shaped diamond here. And it's in the finishing kit. Okay. So I go on the lingual side and I start blending the porcelain and the Ultrabond together. Now it's pretty much cleaned up on the lingual side. And so now we'll go to the labial side. What I use here when you see me scraping on the tooth is an instrument called the Sure 349. This is an orthodontic band seating instrument, okay? And it's in the clinician's finishing kit. You will never, ever scratch Serenade porcelain with this. Don't ever use your hygienist scaling instrument. It'll take off the glaze and scratch it. You can always put the glaze, the shine back, but it's extra work. So, and I'll show you how to do these interproximals. So now we're just going to take some of the open wide now. Some of the Ultrabond off the labial surface, stuff that comes off easy. So now because I have the magnification, and we're going to take a 12 fluted burr, and I'm going to start on the left side. I'm 15 inches from the patient, but I'm 3 inches from this interproximal visually. So now I'm just taking out the Ultrabond because it's softer than the porcelain. And getting this out is so important when you're opening these contacts. Because if I get it all out, then these contacts are very easy to open. And by using the 12 fluted burr and following the outline of the porcelain, you won't see me using this on the labial surface. get in these interproximal embrasures, and I'm just taking out the ultrabond. So now we're going to go in and we're going to take and get the shoulder to blend with the gingiva. See that right here? So if I had an Explorer, or you had an Explorer, there's a shoulder in here. And maybe there's a little emergence profile. What I don't do today, I do a week from now. And I'm using a long, narrow, ultrafine diamond. And I'm just blending this porcelain. So right now, if you have an Explorer, and we'll let the audience that are here do that when I'm finished. And we'll just take an Explorer, and you will find that your margins will be indistinguishable. They blend right in if they're finished. And then you can take care of the emergence profile and the interproximals. Now, the one thing that I don't do with porcelain on the finishing visit is I don't open the contacts, and I'll tell you why. Because it takes 24 hours to get your silene bond really strong. And I have, when I put too much force in there, popped the veneer off the porcelain. So that's the only thing I do different when I'm doing porcelain on porcelain as opposed to natural tooth structure. So let's take a look at his, hey, this is pretty good. This is better than I hoped for. Let's see if you can get in there and take a look at that. Now he's got all his marks on its natural tooth structure, and what I have to look out for is when he goes into his excursions that he doesn't get some eccentric spots in there, that he doesn't get some eccentric contacts. Now, we're going to open his contacts. I guess you're all wondering if I can do that, right? Okay. But I just want to show you how easy it is to open that. And the ones you don't open today, you open when the patient comes back in a week. Then I start rocking. And as I say, what I don't open today, I open tomorrow or next week. So now we're going to take the seri sander on the contacts that I have opened and open wide. And so what I'm doing now is smoothing the ultrabond that's still remaining there to be able to put your dental floss through. And he's got some pretty tight contacts there. And so now we just take the floss through. See? And then when the patient comes back on this next visit, you go and you look at all the contouring you want to do and check your margins and everything. It's just, and they're rested and they're telling you how their friends like it and everything else.
I've been doing veneers for about 20 years. And when I heard you could do Lumineers without preparation of the teeth, that really sparked my interest. The reason I did it for myself is that I had crowns on my front teeth and another crown on the side that I wanted to get redone without having to take the crowns off. It was no pain at all, not a bit. And even when he was contouring around the gums, I didn't have any pain at all. In fact, I went to sleep in the chair. It was so gentle. I mean, he was working on me and I started drifting off, but it was great. They feel wonderful because they don't feel bulky. They feel natural. My bite feels better, feels more solid. I feel very good with them. I'm very, very happy with them.